Hey guys, thank you very much for tuning in. My name is Dan. I'm a sports therapist specialising in pain and injury management. In this little video series, we're going to be looking at how to treat, manage and rehab pain and injuries of the Achilles tendon. Right, let's get on with it. So we're going to start off with a little bit of anatomy and talk about the function of the Achilles tendon. Now, as you probably know, the Achilles tendon is a thick band of connective tissue that joins our calf muscles, the gastrocnemius and the soleus, to the calcaneus, which is the heel bone. Now, 80% of the population also have a third muscle that works as part of the calf complex called the plantaris muscle. Now, this muscle actually has its own tendon which runs alongside the Achilles tendon, but they run so closely together that it's often difficult to differentiate between the two. Now, the function of these muscles is to plant the foot. So when our calf muscles contract, they pull on the Achilles tendon, which pulls on the heel and causes the foot to plant down towards the floor. Now, another little structure to make you aware of is the Karger's fat pad. Now, this sits between the Achilles tendon and the bones that make up the lower leg and the ankle joint. Now, this is there to act as a protective cushioning to stop the bones rubbing on the tendon and irritating it. So what are the most common injuries or causes of pain in an Achilles tendon? Well, let's start with an Achilles tendon strain. Now, a strain, ST rather than SP, is a tear in the fibers of a tendon or in a muscle. And it comes in different levels of severity. So a mild strain is just a few fibers being damaged, which will hurt for a little bit, but usually gets better in a week or so, all the way through to the most severe cases, which is a complete rupture, a total tear of the tendon or the muscle. Now, in the case of your Achilles tendon, you'll probably know if the injury you've had is a strain because it's going to be the result of some kind of traumatic injury, something that has caused you to overstretch the Achilles tendon and pull and tear those fibers. Now, if you have quite a serious case, so a complete rupture or damage to a lot of the fibers, and you're going to find you're not able to plant your foot down, or you're going to get very minimal movement. And that's because that connection from the calf muscles to the heel bone has been completely severed. Now, if you do have quite a serious strain, then you need to get yourself to A&E, because the best way to repair it is to have a boot put on your foot to secure the foot into a particular position to allow the fibers to start to repair themselves and start to knit together. In some cases, they may consider surgery, but with the Achilles tendon, it's such a strong band of tissue that actually usually the body's able to repair itself, so just securing you in a boot is enough to get the job done. You'll probably be out of action for around about 6 weeks, and then after that, you'll start a progressive rehab program where you start to rebuild that strength. Now, one of the most common injuries and causes of pain that I see with an Achilles tendon is Achilles tendinopathy, which is an overuse injury that results in irritation and inflammation in the tissues of the tendon. Now, what you'll often find with a tendinopathy is that there won't be a specific point in time that you remember it coming on. There isn't some kind of traumatic injury. It will seem to develop over time and just seem to keep getting worse the more you use the tendon or the more you continue to use the tendon. Now, obviously, with the Achilles tendon, it's being used every time you're on your feet. So you'll find a lot of movements will aggravate it. However, you'll probably also find that there'll be very little discomfort when you're at rest, so when you're not using it at all. Now, the Achilles tendon is quite a thick band of tissue and it's really obviously visible. So you can quite often find that with a tendinopathy, you can actually see the fact it is irritated. It will look more swollen and thicker than the other side, and sometimes may even have a little bit of redness around the site of the pain. So what causes Achilles tendinopathy? Well, as I said, it's an overuse injury, which effectively means it's the result of you asking your Achilles tendon to handle more load or more repetitive tasks than it is used to or it is comfortable handling. Now, it's really common in people who spend a lot of time on their feet, so that could be for work. It's really common in people who do a lot of long distance walking, and it's particularly prevalent in runners, particularly runners who start training for a big event after doing not a huge amount of running. Now, the reason is when we're running, even at a light jogging pace, we believe you're putting about 6 times your body weight through your Achilles tendon with every single step. If you increase your speed and you're more of a sprint or a faster pace, then that could go as high as 12 times your body weight with every step, which is a huge amount to ask your Achilles tendon and your calf muscles to handle. Now, obviously, if you follow a smart progressive training plan, then you're conditioning your muscles and you're conditioning the tendon to be able to handle that extra load. But if you're someone who goes from doing not a lot to suddenly a lot more, or dramatically increases your pace over a short amount of time, then actually you're asking those tissues to handle a lot more than they used to. As a result, they become irritated, they become inflamed, and we get this tendinopathy. Now, there are other potential causes of Achilles tendon pain. So you may find that you can have issues with the fat pad that sits between the tendon and the bones of the lower limb. You can also get issues with the bursa, which are little fluid-filled sacs that sit in behind the tendon. But Achilles tendinopathy and Achilles strain are the two most common things. So that's what we're going to be looking at over the next couple of videos. The next video, we're going to look at how to start managing the symptoms of an Achilles tendinopathy. And then the final video, we'll look at some rehab for both of those issues. I hope you've found this video useful, guys. I hope it's given you a bit more understanding. I look forward to seeing you in the next videos. Thank you very much for watching.